Hello, this is Dr. Sam Kazia. It has been a great privilege for cardiovascular consultant physicians to take care of you. We are thankful that some of our patients have chosen to share their own stories with you regarding their care here. I hope by them sharing their stories with you, they will be able to touch your heart and your mind just like they touched ours in providing you with information regarding cardiovascular care provided here in our clinics. And thank you.
Hi, I'm Chuck Wooliver. I'm 54 years old from Chesterfield, Michigan, and I'd like to tell you about my experience with Dr. Kazia and peripheral artery disease. About 2 years ago, I was noticing some problems when I was walking. Towards the end of the summer, I noticed that if I would walk a couple hundred yards or so, maybe a city block, that the cramping would get so severe that I would have to stop, wait a few minutes for the pain to subside before I could walk another couple hundred yards. Well, at that point, I determined to talk to my family doctor about it, but he decided to have me checked out by a vascular surgeon who ran a test and determined that I did have blockage in the arteries in my legs. The vascular surgeon scheduled me for a catheterization to remove the blockage, put in a stent, and found that the blockage in my right leg was 100% blocked, and he couldn't do anything with it. My wife and I talked about it. We were a little frustrated, and she said, you know, she really would like me to talk to her doctor. So I went and met with my wife's doctor. She immediately said that if you have blockage in the artery in the legs, chances are very good that you have blockage in the artery near the heart, and that's what we have to take care of first, so let's check that. EKG and another test, and she sent me right over to Dr. Kazia's office. Dr. Kazia ran a few tests, including a stress test, and determined I needed to get on the operating table really quickly to do the catheterization into the heart, and we determined that it did require 2 stents, and there was 95% blockage in the LAD artery, which is one of the main arteries of the heart, referred to as the widowmaker artery. And he told me at that point in time that I was a very lucky man. And that really hit home with me, realizing that, you know, at any given time I could have had a severe heart attack. And I also had blockage in one of my kidneys. It was 85% blocked. Dr. Kazia said there isn't really a lot of research on what happens once a kidney artery is opened up, but if we don't open it up, you will lose that kidney. So we opened the kidney artery up, and I have not had any problems since. We then worked on the legs. It was 4 procedures later and a handful of stents that the blockage that the vascular surgeon could not clear, Dr. Kazia did. From from not being able to walk 100 yards or so to being able to walk great distances. I did an 8-mile hike the other day without any pain. Is phenomenal. I'm actually planning on walking across the country. Why can't I stop in the cities across the way and have a campaign that's built on creating awareness for heart disease and peripheral artery disease. So again, my name is Chuck Wooliver. I'm 54 years old from Chesterfield, Michigan. I'm grateful that I was referred to Dr. Kazia. I owe my life to Dr. Kazia. I believe he saved my life. I've hoped you learned a little bit something about my experience, and my advice to you is to make sure that you listen to your symptoms and make sure that you get checked out by your family doctor. Thank you.